This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
And joining us now live in studio is Dr. Mark Hiatt with Regence Blue Cross Blue Shield of Utah. Good morning to you, Dr. Hiatt.
Good morning.
It's always good to see you. I want to start with this topic that I think people have had, probably in some cases, paranoia about before they go into surgery, and I would think unnecessarily so. But we hear these stories from time to time of a surgeon leaving a sponge behind, or maybe some medical tool behind, only to have it discovered months, maybe years later. Is this really a problem?
It is, Amanda. A lot of surgeries are performed each day, but given that there's about a dozen sponges each day left in people.
Really?
In the U.S.
In people.
And so that's this is according to one report, and so that amounts to about 5,000 such cases each year in this country.
So sponges, what are there any other devices or things that are left inside of people? What are we talking about?
Yeah, it's mostly sponges, Brian.
Okay.
A lot of these sponges can be used in a major operation, even up to 100. But in addition to sponges, needles are left, and about 30% of the time it's surgical instruments such as retractors or clamps.
So what problems result from leaving these things behind?
Well, retained surgical items can cause localized pain, bloating, discomfort. In some cases, unfortunately, Amanda, they can even lead to sepsis or even death.
Well, and I would think, because, the sponge can just be stuck in between and you wouldn't... Oh, my goodness.
Man, that's crazy.
And it's the pain that brings the patient back in?
There was this one recent case of this unfortunate woman in Japan who, after her 2 cesarean sections, had this continued pain. And upon imaging, it was discovered that, in fact, 2 sponges were left in her abdomen,
No way.
which had to be taken out.
So is this a case of distraction? I mean, why do all these things keep happening?
Certainly, we think it's a distraction that may contribute to this occurring. Also in cases of high stress, such as an emergency surgery, or when there's been some change to the procedure. And it's not hard to imagine how people could lose count. Like, imagine yourself trying to count the number of cards in a deck.
Right.
And oftentimes you'll miscount and not get the 52. Well, when you have 100 items that need to be accounted for, sometimes it happens that you just simply miscount.
Small percentage, though. We should
Very small
point
percentage.
that
Yeah.
out.
All right, let's talk about this now. We've talked a lot before about concussions, and there's a really cool thing. This new, a new way to detect concussions?
That's right. The U.S. Food and Drug Administration, Brian, has recently approved this new blood test, whereby a concussion may be more easily detected.
So how does the test work?
Well, it works. It's able to detect in the bloodstream 2 proteins that are released from the brain when the brain is injured. And this test, within, say, 15 minutes or so, it can detect these circulating proteins.
So time is already one advantage. Give me some more advantages to using
Well,
something
the
like
other
this.
advantage is, it can detect these elevated levels of these proteins as early as 15 minutes after the injury. But these proteins remain circulating for up to 12 hours.
Okay.
So there's a very long window.
So how are we detecting concussions now?
Well, currently it's really based upon a combination of symptoms as well as imaging, such as through a CT scan.
So could they take a blood test right on the field, or I guess they take them back into the locker room?
So the idea, hopefully, and currently this is being made available to emergency rooms, but the hope of the manufacturer is that this can be made available on the battlefield for soldiers and on the football or soccer field at the sidelines, such that you can know right there on the spot if there needs to be further investigation.
Wow.
Because if you know right away that there's been a concussion, you can start the treatment that much sooner, and
That's right.
That just helps people's health.
That's right. But the nice thing is that you avoid subjecting those who don't have injury to a CT scan, which may be much more expensive and does expose them also to radiation.
Gotcha.
And it removes the guessing. But that's
There you
fabulous.
go.
Thank you, Doctor.
Okay.
This portion of Utah's Morning News brought to you by Regence Blue Cross Blue Shield.